This morning on Community Spotlight, we're talking about Banner Payson Medical Center, and with us a little bit of a focus on their OBGYN practice there. We have Dr. Cynthia Booth with us, and also Dr. Kevin Murphy. And first of all, thanks to both of you for being with us this morning. We appreciate it.
Thanks for having us.
There's, I guess one of the first questions that comes to mind is, I think when a lot of people think of OBGYN, they think of babies. And I would think that must be one of the more gratifying aspects of work in your area. Would that be right?
Oh yeah, I have to agree with that.
Yeah, absolutely.
Yeah, it's a high every time. It's wonderful. Yeah.
How many babies have you delivered, Cynthia?
Oh my gosh, I think I stopped counting at 2000, so I don't know.
2,000.
Yeah,
wow,
I mean that was years ago.
You're probably starting to get the hang of it then, huh?
Yeah, a little bit.
Yeah. And how about you, Kevin?
I think I'm probably somewhere around the 300, 400 mark.
Wow.
At this point.
And it must really, like Cynthia said, there must be something kind of little extra special every time.
Yes.
Yeah. That can go a lot of different directions.
They can.
It can. That's a loaded question for sure. There are good ones, there are bad ones. When they're good, they're great. And that's really what I think what brought me to the field. When it's really happy, it's wonderful. It's an amazing experience.
We have a saying: some are easy, some are hard.
Oh, yeah.
And it's just the way. And the other thing in OB, probably very much like emergency medicine too, is you can be going one direction just fine, everything's looking great, and then all of a sudden you are doing a 180 and you're going the entire different direction.
Wow.
Just like that. So
That's got to be a
it's exciting.
little hairy at times.
It
Yeah.
can be.
Now the other thing, I guess, that it seems like a logical question to ask too is with all of over the last year and a half, all the COVID-19 stuff going on, I know that there's many different areas in medicine where elective surgeries and things like that have been put on the back burner, because of just the demands placed on medical staff. Has that affected you all here?
Oh, sure. I think initially
And that's
it
my loaded
affected
question.
everybody. Yeah. I think, it shut down almost all elective surgery throughout the U.S. and elsewhere. And then, we kind of got a handle on things and processes and how to protect patients and each other and keep things going
Right.
as best we can.
Interesting. Now we also have our intern here at KRIM, Ashlyn, with us this morning. Ashlyn, glad to have you in there in the studio. You were actually just off in New York last week, enjoying Times Square and all of that. Well, sorry you had to come back, but
Me too.
anyway, interesting topic when it comes to talking about physicians. It seems like here in Payson, just about everybody knows everybody, and so I think especially for small market physicians, whatever the proper term is, for smaller communities, it's got to be a little different than like maybe working at some of the hospitals down in Phoenix where you don't necessarily have a whole lot of direct ties to some of the people that you see coming in, whether it's in an emergency situation or otherwise. Am I way off base with that one?
Not at all. I think you're spot on, honestly, and that's the thing that I love the most about practicing in Payson. I think some people that might deter them in some way. I love running into people at Safeway. It's awesome.
I agree. I had the privilege of practicing in the Valley in Phoenix for a while before I moved up here, and very different. And I agree. You either love anonymity or you like being able to see people and know that both your patient and your neighbor is who you see at Safeway or wherever. Yeah.
I feel like there's a different type of accessibility to your doctor that way too, right?
Yeah.
People feel comfortable walking up and just being like, oh, by the way, I need to make an appointment for blah, blah, blah.
They do.
And
There's been those times at Walmart.
Right?
Yeah, I have to say, that's where I was going next with this, because I know I have a couple of personal friends who are local physicians, and in going out to lunch or dinner with them, it's always amazing how many people will just walk over to the table. Oh, but I have this pain back here, and I'm always waiting for these doctor friends of mine to say, "You think that's a pain? You ought to be standing in front of you." But that has got to get a little old after a while.
I don't know. I don't think it does. I think for the most part, people are very respectful.
They are, yeah.
Oh, good.
And
yeah.
Nobody really ever says anything
They don't take
inappropriate.
advantage.
Right.
Yeah.
No. And the other cool thing is, I was going to say on the baby front, is I've had the ability to take my kids to soccer games and other activities and stuff, or go over to the elementary school, and you just look out and you go, oh, I delivered half this class or more.
And if it's a kid on the other side, it's like, hey, I brought you into this world. I can take you out.
Right, you're welcome.
No, I love it. Now, what's again, with all the different, there's so many more specialists in Payson now than there used to be when I first moved here 40 years ago. When it comes to specifically OBGYN practice, are there misconceptions that people have when they maybe come to you for the first time, or when they just think about your area of practice? I mean, are there significant misconceptions that people get hung up on, or not so much so?
I'd say probably to the point of, oh, like, you just deliver babies, right?
Mhm.
OBGYN is a very broad field, and there's a lot that we do. The whole gynecologic part of the OBGYN is, we're soaked in surgery, and there's a lot of different types that you do, whether it be full hysterectomies, a lot of things in the abdomen, doing laparoscopy. So you get a lot of the reason people go into OBGYN, or you hear this kind of on the interview trail a lot, is that OBGYN holds a kind of a broad view of medicine. You get a lot of primary care, you also get to be a surgeon in a lot of ways. You get emergency care in the OB field a lot, and then you get to do a very unique kind of specialty, which is the obstetric part, right? There's nothing like the pregnancy aspect of somebody's life. The physiology is completely different.
Yeah.
The actual delivery itself is very unique in medicine. So
Yeah.
you get to do a lot.
Yeah, and you're right. They see you in scrubs and they think, oh, did you just deliver a baby? And a lot of times it's surgery.
Yeah, right.
We've just gotten out of the OR. And that's another thing too. I would say the one misconception that people will come to the practice with is, well, I had a hysterectomy. I didn't know that I still needed to come in.
Mm-hmm. Yeah.
You know,
Yeah.
we-
Thought everything was taken care of
We
permanently.
do hear that
Right.
a lot, and it is recommended to, keep having checkups.
I know with my wife and I, when we had our first child, which was a little over 40 years ago, golly, time flies when you're having kids. Again, it was one of these things where, we figured that, she should go into labor anytime, and she didn't, and she didn't, and then she didn't. And so finally they decided they were going to induce labor, and so we went down and they did that, and she was really struggling, and they found out hours into this thing that apparently she had some curvature to her tailbone that prevented typical delivery, so they had to hurry up and do a C-section. And then again with our son, our second child, when he was born, we knew it was going to have to be a C-section. So it was a very casual thing. We just scheduled it. I think Tuesday at 2:30.
When you're walking into it, that's for
Yeah.
sure. Yeah.
But the weird thing for me anyway is I'd always had this strange, at that point in my life at least, this strange image in the back of my mind's eye of surgery being this very delicate, precise little thing. And when it came to the original C-section, as I understand it, and correct me if I go astray, from the time anesthesia is administered until the baby's out and disconnected, it needs to be a pretty short period of time.
Yeah.
I'm probably oversimplifying, but
No, you're right.
but nonetheless, I was again expecting all of this very precision work, and I mean, this is like one at the meat market. I mean, it was amazing. But it was, and so that was kind of a bizarre thing. Of course, they put my wife under because she'd been in
Yeah.
labor for a long time. When our son was born, it was one of these deals where they gave her the spinal tap, and so they got the drape up, between the top half of her and the bottom half of her, and I'm standing in the middle looking at both sides of that whole thing. And it was also very unusual to just be talking to someone while all of this other stuff is going on.
Right.
Yeah.
That's got to be a little unusual the first time you.
It is
take
one
part.
of the most
Yes.
unique aspects of surgery. There aren't surgeries where family is
Right.
involved and awake talking to you sometimes during the surgery. There's
Right.
no other surgery like that. It's also unique in the fact that, as you said, you expected it to be kind of delicate. We are delicate. Don't get us wrong.
I
but-
didn't
but-
mean to overstate
No, I'm
that,
just,
but yeah.
I'm just playing. But it is one of the only surgeries that is, I wouldn't say routinely, but it is expected, and you're trained often in having to do it as fast as possible. We call it
Yes.
stat C-section,
Mhm.
right? There are definitely some emergency situations, traumas and things like that, where
Mhm.
surgery has to be done very quickly.
Right.
But we see it quite often in our field, and so there aren't a lot of surgeries where you're like timing yourself, and it can be stressful. It can also be kind of fun.
Right. Well, I know with the medical field in general in Payson, with the demographics here being heavily weighted towards retired population, there's many things that perhaps at one hospital they might see a majority of their patients might be younger, and as a result, they're going after, A, B, and C different things on a routine basis. But here in Payson, when it comes to OBGYN, and with again, a pretty significantly weighted population in the retired crowd, and I think I'm basically going towards something that you had mentioned earlier, Kevin, and that is that everybody thinks that OBGYN is just, about, bringing babies into the world, and there's a whole bunch of other stuff, especially when you got a significant retired population.
Absolutely, yeah.
And is that, I mean, are there when we talk about the senior population, are there particular things that come up the majority of the time, or is it just a broad spectrum of things?
Yeah, I would say there are.
Yeah, definitely prolapse issues. As we age, the
Right.
organs tend to sag down. Correcting those things can be done surgically, can be done with some more conservative measures. But we see a lot of patients for that. Hormone replacement therapy is a big one.
Hormones, menopause issues, sometimes postmenopausal bleeding issues,
Right.
which,
Yes.
And I didn't realize that the prolapse thing you're talking about. I know my late mother, late in her life, she had that problem. I had to have a mesh implant put in the sling, I guess, of sorts, to kind of keep everything from going down
Falling
further.
out,
yeah.
Trying to figure out a a way to say it, and there just
Yep.
Yeah,
isn't.
there's nothing delicate in OBGYN, that's for sure.
But it is pretty amazing that kind of stuff can be done.
Yeah, definitely.
Now, the same similar question, Cynthia, is to what I asked Kevin earlier as far as misconceptions. What about just the retired population when it comes to, maybe things where I didn't know I had to keep track of that, or that this could happen, or that? I mean, are there misconceptions with OBGYN in the senior community?
Well, yeah.
I mean, at that point, we've gotten past the baby making aspect of things. So.
I think one of the common things that I hear a lot are, again, lack of getting in to get checked. And, when's the last time you had a breast exam? And, I just had my mammogram.
Right.
Which is an imaging, thing, and not an actual hands-on examination. So we think both are important.
Yes.
Yeah.
Makes sense. And when it comes to, that right there brings up a whole bunch of different things. So there's things that with a physical manipulation that you can tell that you might not even see on the imaging.
That's right.
Wow.
Yeah.
And the older we get, the more of a an issue that becomes.
Yeah.
Most radiologic groups recommend that you do both because they say, I think it's 15% of cancers could potentially be missed if you're only doing one or the other.
Right.
Oh wow.
Mhm.
So it requires both.
Yeah.
All right. Now, and as far as other female-related issues, later in life, we're probably not needing to do necessarily pap smears and things like that as much more often. I mean, how do you figure out all
After the age
that?
of 65.
That's a great question.
65?
Yeah, guidelines changed. And, way back in the day, we say, get your pap every year.
Right.
And that's because we really literally knew nothing about cervical cancer other
Right.
than how to find it under the microscope. And that's the pap test. Well, then we learned more about it. We learned about human papilloma virus, and that this is the cause of the vast majority of cervical cancers. So once we learned about that, we were able to investigate a little bit more about the kind of natural progression of human papilloma virus. It is a virus, and the body wants to take care of it, like it does with its immune system.
Right.
And so a lot of times it can clear it on its own. There are times where it can't. But so our screening recommendations have evolved over time. And now we're to the point where typically in your 20s, you're getting a pap test about every 3 years, And then after age 30 to 65, it's about every 5 years, along with an HPV test. So we can do the pap and the HPV. And then after age 65, this is one of the rare things that we can say about a cancer after the age 65 that actually does decline with age. If you have had, a long history of normal paps or very minor abnormality after the age of 65, we stop doing cervical cancer screening if that's been your history.
One of the things, on a bizarre side note, one of the things that I was reading about recently that I thought was kind of interesting, everyone's talking about the COVID situation, and as well they should. But I was reading that depending on your blood type, certain blood types are less impacted by the COVID-19 the coronavirus than others? I mean, have you heard that, or should I stop reading Mad Magazine, or?
I would say that blood type is
That's-
sort of implicated in all kinds of different
Yeah.
things, and so I'm not surprised that that's come up, but I really don't know.
Yeah, no, exactly. I've heard that. I don't think they have identified exactly what blood types and to what degree you're protected or
Right.
more susceptible
Well,
to the virus.
and where I was headed with that was when it comes to things like uterine cancer and things like that. I mean, are there some people groups that are more apt to have those problems than others? I mean, are certain blood types more apt to have certain challenges than others when it comes to OBGYN concerns?
Not that I'm aware of. I mean, there are risk factors for those
Sure.
things,
Sure.
and I mean, I don't know. This is my take on blood type. We inherit our blood type
Sure.
similar to how we inherit our immune system, and we inherit our digestive systems, and so how our bodies handle things. So it makes sense that it might be linked, but I don't know that there's necessarily a causal,
Right.
relationship
That makes
there
sense. That makes
between
sense.
blood types.
Now, as far as the biggest mistakes that people make, as it pertains again to OBGYN, is it the not
My mistakes or patient mistakes?
Oh, we're just talking about the patients.
Okay,
We'll talk to you about the other some other time. No, but as far as patient mistakes, is it just foregoing the routine exams and things like that? I mean, is that the most common, or I mean, what are some of the other things that, boy, if you could reach out and
That's a great
shake the world by the shoulders and tell them something that they'd listen to, what would it be?
I would say focusing on the OB population, especially around the time of delivery, but really any time in your pregnancy. You do not need to think that any of your concerns are just, it's probably just in my head, or I don't know, maybe that's just everybody experiences that. There are some pretty serious situations that can happen in OB, and I've heard, unfortunately, too many anecdotes of people who, for example, were like, oh yeah, I had this headache, I don't know, it'll go away, let me sleep on it, right? And it ended up being eclampsia in the end, and they seized and had bad outcomes. So I would say just people in general, we can be pretty stubborn. It's hard to say,
You've met my
maybe I
family.
should. Exactly, yeah. They're very nice people. No, it's it's okay to reach out and try and contact your doctor.
I think
For
being
pregnancy.
overcautious is right. Yeah.
Yeah.
Mm-hmm.
So, erring on the side of caution is rather than just blowing it off.
Yeah, I mean, that's what we're here for.
Yeah.
Right?
That's right.
That makes sense. Now, and misconceptions in society in general about OBGYN? I mean, are there some things that you hear people like, man, what were you thinking when you came up with that idea? I mean, do you ever come up with folks that have some just really off the wall? I'm looking for some meat here.
Honestly, every day, and yet I cannot pull one over in a whole.
Oh my gosh.
Let me go to
yes.
think about this.
Well, I didn't know I could get pregnant. There's
There you
one.
go. There you go.
There's
Yeah.
I think I knew her.
Yeah.
Right.
I didn't know I could get pregnant while breastfeeding, or
Oh, wow.
That's I mean, if we're gonna go into it along those lines,
Not going to mention any names or addresses.
there we go. We have a lot of patients who, after recently delivering a baby, we want to talk to them about contraception moving forward. The reason isn't because, oh man, you got a baby, we don't want you to have another one, that'll be hard. It's not that. It's that there are risks involved with what's called a close interval pregnancy, right?
Mhm.
Having another pregnancy within the next 18 months.
Oh.
So we try and counsel them towards that. Something I hear all the time is, oh no, he's not coming anywhere near me. They'll show up a month later. I feel like that happens almost once every other week here, yeah.
Yes.
And
then you're pressed with having to keep a straight face and everything. That's got to be a challenge in and of itself.
no, never.
Yeah.
Well,
And then a couple others I would have to say, so around STIs, sexually
There you go.
transmissible infections, that's another one too. People don't always think about getting checked for that, and that is important to do. And there's another
no, that was, and
factor.
the abbreviation there was what again? The
STI.
STI. So sexually transmitted.
STDs, yeah.
Yeah. Okay. I was,
Yeah, we've kind of gotten away from STD
Yeah, it's
lately. People get that mixed up with short-term disability, and
yeah, there's a whole nother
Yeah.
talk show
Yeah.
there. Yeah. Interesting though. So, but I mean, as a society, are we wising up a little bit to some of that when it comes to the sexually transmitted infections, things like that? I mean,
I feel like it. I feel like it's probably a little bit better than it used to be. Yeah.
Yeah, you'd be able to speak to that a little bit for sure.
well, I know it seems like, when AIDS first came out, I mean, it was a horrible thing, and now that's much more a treatable thing, and so
Yeah.
I think people are looking at it a little differently, but I don't know
Yeah.
if that caused us to be more lax in the way we take care of ourselves or address those kind of threats or anything, but it sounds like we've actually wised up a little bit, maybe.
A little bit. I honestly, in your age group, Ashland is probably the worst because they don't think about it, or
Right.
they're omnipotent, and they feel like that won't happen to them,
Right.
and it does.
Yeah,
So,
interesting. Yeah, I remember those days a long time ago.
yeah.
Fortunately, I'm with the same gal that I was back then,
There
so
you
it's a
go.
good thing. 40,000 years later.
Mhm.
But as far as, again, specifically with the OBGYN focus compared to a lot of the other practices at the hospital, I mean, do you all have to, at times, depending on the situation, you have to work with each other through, I mean, it's a multidisciplinary sort of thing, dealing with, so you're dealing with lots of other doctors, different specialties and stuff like that.
Mhm.
Yes.
Yeah.
This, and I mean, again, I'm speaking in vast generalities, but I mean, is that would seem, especially if you're in a situation where there's maybe, some emergent situation that you're dealing with, that can be a real challenge at times, just, cutting to the quick and just the facts, ma'am, and instead of, perhaps all the other dialogue that would go into that. Am I way off in left field, or?
No, I don't think so, and I think you hit the nail on the head, especially in the emergency situation,
Yeah,
in the emergency room.
Yeah.
If you have a ruptured ectopic pregnancy, you have a ruptured ectopic pregnancy, and we're gonna take you to the OR, and,
Right.
we're gonna get the basics and that, but obviously not delve into your last pap test.
Right.
Interesting,
Exactly.
yeah. Now, there's a bunch of other questions that I'd like to ask, but being a small community, I know that, we're gonna end up talking about something that someone's gonna be bothered about, me asking about, so I won't go down that road, but if people have, even the slightest bit of concern about, gosh, they're talking about the need to do pap smears routinely, and it has been a while, but, I'm not really sure if I understand. I mean, can they just call your office with a question as far as,
Sure.
when do I need to come in for this, or do I all need to come in?
Oh,
or
sure.
what's the best way to do that?
Absolutely. Yeah. And, another one that I was gonna say, a misconception that we hear an awful lot is around breast cancer screening, because there's the whole idea around stopping your mammograms after, was it
Yeah,
age 74 or 75?
yeah.
And I think, and even some will want to stop before that, because I don't have a family history of breast cancer.
Right.
Well, I think only 20% of breast cancers actually, that person has a family history, and the rest of them do not have a family history.
So it's
So
not,
that's a misconception, yeah. And then with regard to stopping your mammograms, I mean, I think that the way we've gone with that is really just shared decision making on that. How often to screen, even before that, because there's the American College of OBGYN would recommend annual screening, starting in your 40s and onward from there, and others say, every other year, and then, like I said, stop after age 75. So I think shared decision making, that's another thing that we've really come around to, is making sure that we tailor your screening to you individually. What are your what's your family history? What is your own history and risk of that? So
makes sense.
100%.
And we're just about out of time, but it would make sense to also, I guess, give an opportunity to talk a little bit about if there is someone out there who maybe is just pregnant for the first time and they're hearing this. Give us a few words on how important it is to come in and see an OBGYN during this, rather than I'll just I don't want to deal with. I mean, what are some of the disadvantages by not going in and seeing a doctor as routinely as?
I think education
Definitely.
right off the bat
Right.
would be my thought.
And I would think that just so people knowing more what to expect if they haven't been through it before. That, I mean, to me, that would be huge to be able to talk to you and have you say, well, you're going to experience this, and this, and without being told that up front. I think when you first maybe experience something different, you might be alarmed or something, where that could help put a lot of fears at ease, maybe.
There's a lot out there. Dr.
There's a
Google
lot
has
there,
a ton,
exactly.
and so there is a lot out there with regard to what to expect. I feel like my benefit for them when they come in early in pregnancy is talking about the don'ts.
All
You
right.
know, really avoid
Yeah.
this,
Avoid the 5 shots
yeah.
of tequila this evening.
Yes, alcohol, drugs,
Only 3.
including marijuana.
Right.
I mean, you know, yeah, there's a lot of
That's a good point too,
misconceptions on
though.
it.
Marijuana, even during pregnancy, that can have deleterious impacts as well.
It's recommended against in pregnancy and in lactation breastfeeding. Yeah.
Interesting.
Mhm.
All right, so CBD milk is not necessarily what's recommended.
Not for the baby. That's right.
Okay. Anyway, now people want to find out more. Again, going back to the idea of questions, different phone numbers for each of your offices?
Nope, same phone number.
Same phone number. What is that number?
It's 928-596-4700, 4700.
Okay, great. And again, if you just tuned in, we've been talking with Dr. Cynthia Booth and Dr. Kevin Murphy. They're both OBGYN specialists at Banner Payson Medical Center. Thanks to both of you for coming in. Appreciate it. It's been interesting and insightful.
That was wonderful. Thank
All
you.
right, thank
for
you.
having me.
And we got to get you back to more of your favorite music. Have some tunes coming up from Prince, Procol Harum, Dave Matthews Band, The Police, and more. But first, a quick look at RIM Country weather.
I'm gonna stay around for Prince.
What's that?
I said I'm gonna stay around for Prince.
Yeah, there you go.